Professor Janet Kasili Barasa, His Excellency Honorable Ayub Sabula, the Deputy County Governor of Kakamega County, members of the County Assembly here present, the Kakamega County Executive Committee Member of Health, Dr. Bernard Wasonga, all other invited CECs, Chief Officers and Directors present, representatives from the Sub-County and County Health Management Team, administrative and political leaders present, all invited partners, ladies and gentlemen, good afternoon. First of all, congratulations, Your Excellency, and the entire county health team and all partners involved in the development and launch of the Health Services Fund today. I remember, Your Excellency, when you came into office last year, the Service Delivery Design Partners, a consortium led by Jacaranda Health and with other partners here present, who I'll mention a bit later, we had a meeting with you. And I think one of the things that really struck me was that you are really keen also to hear from outsiders who had been working here in the county, what sort of challenges we were seeing. And one of the things that we pointed out was around financing healthcare in Kakamega County. But what struck me was that even within very few weeks, you'd already seen all these problems, and you knew what needed to be done. And you committed that you are going to launch this Health Services Fund. And so for me and all the other service delivery design partners, I think it's really a fantastic day. And so I'm speaking not only on behalf of my organization, Thinkwell, but on behalf of this entire consortium led by Jacaranda Health. And even before I proceed, I'd just like to welcome the Deputy County Director of Jacaranda to stand and wave to everyone. Asante sana, that is Dr. Job Makoyo, the Deputy County Director of Jacaranda Health. As we launch the Health Services Fund today, it's worthwhile to note that this is the culmination of a lot of work by very many stakeholders led by the county government of Kakamega. thinkwell is a global health systems development organization that uses tailored health financing approaches to support countries in their journey towards universal health coverage. As you all know, universal health coverage is one of the key agenda items in the manifesto of our governor. But what does universal health coverage mean? For Wekesa or for Nanzala, or whoever you want to call them, universal health coverage means that when they walk into a health facility, someone goes to Malava Hospital, for example, they expect to find that the staff are there, the staff have the right skills, the staff are motivated, and this includes the casual workers, and that they attend to Nanzala, and she receives the medication or the services she needs without having to incur financial hardship. And therefore, universal health coverage is truly about high quality and affordable healthcare. Thinkwell and the other partners recognize that achieving universal health coverage requires addressing complex health system challenges, including development of policies, financing mechanisms, and service delivery models. As part of the Service Delivery Design Consortium, that is known as Tutunza Kakamega, Thinkwell was entrusted with the responsibility of supporting the county government of Kakamega in enhancing health financing systems, and in particular, in supporting the county to design this Health Services Fund that we are launching today. And through this partnership with the county government, Your Excellency, we aim to strengthen the healthcare delivery system and ultimately improve the health outcomes of the people of Kakamega County. This Health Services Fund will strengthen health facility autonomy. What that means, as the CC said, is that facilities will be able to raise and retain the resources that they get from NHI, from user fees, and from other sources. These funds will be ring-fenced into this county health fund, so that facilities have the flexibility to respond to the needs of their communities and enhance service delivery. This fund will improve the flow of funds to frontline providers. And I think you'll agree with me, Your Excellency, that you cannot hold your health workers and providers to account unless they have the resources that they need to provide the services that you expect them to provide to the people of Kakamega. And so as the county takes this bold step towards a patient-centered and accountable, innovative healthcare system, all eyes are on Kakamega as a trailblazer in transforming healthcare delivery in Kenya. Ladies and gentlemen, I'd like to talk a little bit about the service delivery redesign project dubbed Tutunze Kakamega, which is a transformative initiative and the first of its kind globally, and all eyes globally on this project that is being implemented here in Kakamega and the only project in the world. Tutunze Kakamega is a project that is led by the Kakamega County government that aims to improve maternal and newborn survival by shifting where and when mothers access care. It's about ensuring that mothers who need a delivery service can get it in a facility, a hospital, providing high quality care, and this is a well-functioning hospital with the equipment that is needed to provide services. This project is led by partners, Jacaranda Health, that is leading service delivery and supporting the county government with service delivery. We also have thinkwell Kenya, that ensures that the mothers' voices are taken into account when designing solutions. I think you'll all agree with me that it's absolutely critical to make sure that we are listening to our mothers and the people who receive services from our health facilities. We also have Rescue Connect, that runs flare emergency response, an ambulance service that has reduced the response time for mothers and babies requiring emergency evacuation services. Since the inception of the project, I'm delighted to report that a number of milestones have been achieved. In terms of equipment and infrastructure, we've supported the county government to build and equip the maternity theatre and the newborn unit in Malava Sub-County Hospital, in addition to renovations at Lumakanda Hospital. In terms of emergency transport, the consortium has supported the evacuation of more than 6,000 pregnant mothers and newborns requiring urgent medical attention. And in terms of bringing the voice of the mother on board, we have tested innovations such as ticketing services at a number of health facilities that have improved and enhanced the user experience at health facilities. And development and launch of this health services fund has also been one of the key initiatives that this project has been supporting. So as the county takes this bold step to launch this fund, for us as a service delivery design consortium, we'd like to congratulate you, Your Excellency, together with the entire county health management team. We look forward as a consortium to continue working with you, and also urge the Department of Health to also support the facilities in managing these funds to ensure that they're also well resourced and that there is no disruption in health services. We also urge providers to take advantage of this initiative by the county government to increase the amount of resources that they are claiming from NHIF, to make sure that these resources are actually flowing down to providers and actually helping to improve the services for the people of Kakamega County. God bless you, Your Excellency, and God bless the people of Kakamega. Asante sana.
Thank you, Dr. Ann, for those remarks. Before I call on the County Assembly, I just want to recognize